Hi, this is Keri Sullivan, pulmonary nurse practitioner. I'll be speaking today on behalf of Kendall McCarty, inpatient asthma nurse practitioner. Kendall developed a project looking at assessing knowledge before and after asthma education. Asthma is a leading cause for pediatric hospital admissions at Boston Children's Hospital. Asthma education is a vital component of caring for a family with asthma. Many families decline education, stating that they don't need it. Simultaneously, nurses discharging these families are reporting that there are gaps in family knowledge even after receiving education. The purpose of Kendall's project was to develop and implement a non-threatening asthma educational assessment tool to measure knowledge before and after receiving education and to tailor asthma education to individual learning styles and needs. Kendall developed a tool comprising of 6 most important aspects of asthma care. The tool asks questions 1 through 6. Does your child have an asthma action plan? What do you do to keep your child in the green zone? What do you do when your child is in the yellow zone? When do you call your child's healthcare provider? What do you do when your child is in the red zone? And can you demonstrate proper inhaler technique with spacer? 5 items related to asthma patients and their asthma action plan were also described, and one asked the patient to demonstrate proper inhaler with spacer technique. Questions were asked in a non-threatening manner during a more focused asthma history. The family received either class or individual education, an asthma educational booklet, and an individualized asthma action plan. Questions were asked again after the education was provided. Data was collected on 42 patients between April of 2019 and October of 2021 using REDCap at Boston Children's Hospital. In general, 22.5% received class education and 77.5% received individualized education. 5 of the 6 questions related to the patient's asthma action plan were answered. The 6th question, as I mentioned before, was related to the inhaler with spacer technique. In general, the study showed a significant increase in the percent correct answers post-education. Implications and next step for practice. Formal pre and post testing is intimidating for patients and families. Engaging families in a non-threatening conversation about their understanding of their child's asthma action plan is an effective way to understand where gaps in knowledge are so that education can be tailored to the individual and their family. A teach-back method is vital to ensure whether information taught was retained. It's important to note that due to low volumes of hospitalized asthma patients during the summer and COVID pandemic, the sample size was small, and it is recommended to repeat the study, perhaps during the fall of 2023 through the winter of 2024, in order to attain a larger sample size. To eliminate bias, it is also recommended to have a different provider perform the post-education assessment instead of the same provider who completed the pre-education assessment and education. Thank you.